Today we're going to be talking about vicarious trauma. That is, for those people who are working with victims of trauma, how do we maintain our own emotional health? And this is something that people sometimes don't think about or don't talk about, either as individuals or within agencies or businesses, but it's an area that's very, very important. Because in order to be able to be emotionally available in working with people who've been exposed to trauma, we have to make sure to maintain our emotional health. So the goals of the presentation are, first, understanding the importance of vicarious traumatization and compassion fatigue. What do we mean by vicarious traumatization and compassion fatigue? And I will define that as we go along. Then we want to gain an understanding of risk factors for symptoms of vicarious trauma. And then finally, we'll think about ways to take care of ourselves so we can help others who experience trauma. So first, the definition, or one definition of vicarious traumatization, a process through which a therapist, but it also can be some other person, it could be a child welfare worker, or it could be a judge who's dealing with a difficult case, or particularly important for people working with young children who are so vulnerable. So a process through which the therapist's inner experience is negatively transformed through empathic engagement with the client's trauma material. So that's the definition for a mental health professional, but again, vicarious trauma occurs across different professions and for people working with trauma. We can think about police officers. We can also think about photographers at the time of a disaster where they're taking many pictures, or some traumatic event or mass trauma event. So vicarious traumatization can occur for many different people. Another definition, secondary traumatic stress. Stress that comes up from helping or wanting to help somebody who's suffering or someone who's traumatized, and Figley defined it that way. And what causes it is hearing over and over again the stories about stressful events or trauma. One of the things that's very important for people who've been traumatized is to have somebody who will listen to their stories, and really hear them. But if you hear stories over and over again, it can be traumatizing. And helping professionals of all types are at risk. So obviously mental and behavioral health professionals, but again, doctors too. If they take time to listen to the stories, or people come in and tell them about all their family problems, that can be very difficult. Again, I mentioned judges who are continually hearing about stories, terrible stories that happen to children. We work a lot with juvenile judges and they go through that. Police officers are always going after difficult situation and witnessing traumatic events. So helping professionals are at high risk. And what do we mean by burnout? If there's a level of secondary traumatic stress or vicarious trauma, it can lead to burnout. With burnout, you see reduced effectiveness at work, and a person can feel helpless or hopeless. There can be a lot of frustration and anger that occurs with burnout. So they say, I don't want to do this anymore. Being angry at people you work with, being angry at bosses, being angry at the system. There are a lot of people in very difficult situations where the administrative pressures of the work can create that kind of frustration and anger and burnout. So actually, when you work with trauma, the symptoms that come up if one has experienced vicarious traumatization can be similar to those of the victim. How long they last is specific to the individual, and if a helping professional or someone who is dealing with trauma and their material all the time in their work has had a prior personal trauma, they can be much more vulnerable to developing vicarious traumatization themselves. Common symptoms, they're comparable to post-traumatic stress symptoms. Sleep disturbances, inability getting to sleep, having nightmares, fear, anxiety, pressure, irritability, just being annoyed in situations and finding yourself becoming more irritable and more anxious. At the same time, there can be blunting of emotions, not wanting to feel anything and just backing off from things and withdrawing. As we mentioned, sleep disturbances, there can be nightmares and also flashbacks. If one has experienced some kind of trauma, for instance, a car accident, and you see another car accident, you can have a flashback. There certainly were flashbacks that occur when huge hurricanes hit an area nearby, an area that's already been affected. We certainly saw this occur for people where I live in New Orleans when Hurricane Harvey was in the Gulf. There were a lot of flashbacks to Katrina that occurred, and certainly for people, again, who were in Texas who had evacuated from Katrina were having significant flashbacks at that time. So these are some of the common symptoms that occur. What are the risk factors for developing secondary traumatization? Feeling it's so important to help other people and to do well at it that you measure how good you are, your self-worth, by what you do. And with that, have unrealistic expectations of what you can do and how you can help other people, and the expectations of yourself that you're a failure if you can't. Also, not being able to talk about feelings or seek help. So feeling others will judge you if you show that you're experiencing some trauma and you ask for help and you express that. Other people, you might fear that other people will think you're not very strong, you're not very good at what you do. Being unable to give or receive emotional support. Closing down and not being able to talk to people and not being able to listen or help other people at some point. Overextending yourself, have too many things going on at one time so you just feel pressured, and essentially letting work take over personal time. We'll be talking a little bit later about what we can do about those circumstances, but where all you do with work and you don't take any personal time or time off, and that can certainly lead to secondary traumatization. So there are many adults who may be affected by working with child traumatization. Obviously, parents or caregivers, parents where a child has been traumatized and where they love the child and they're trying to help them, and that may be very, very difficult for them. Certainly for foster parents who are dealing with children who've been abused and neglected and may show difficult behaviors, they can certainly experience some child traumatization. Child care providers and teachers who over and over again see children who have been traumatized in one way or another. They may have been some incident that traumatized them. They may be in a household that's very difficult, a dysfunctional household. They may have to care for their younger siblings, and teachers or child care providers may find it overwhelming if they have quite a number of children that way. Major people who are affected are interveners, child welfare workers, community workers, and treaters, health and mental health care. So those are major people. We don't think about the media that much. I mentioned previously having to hear stories over and over again about trauma or violence, and also having to report them and having to take pictures without any way to process what it is that you're taking in. First responders, police, firefighters, EMTs who are constantly responding to traumatic events can get overwhelmed at some time. Judges who are hearing very difficult cases, juvenile judges with cases of abuse and neglect, juvenile judges with violence that occurs over and over again, criminal judges. Probably this is not something that judges talk about very much, but it certainly can be something that comes up for them. And then we mentioned foster parents before, and the role of foster parents and the support they need, because often the children that they that come in to them for them to take care of have been through a lot of trauma themselves. And so it's very important that they receive support and also learn more about the effects of trauma on children and what to expect. So what can happen in working with traumatized children and families? First of all, very powerful feelings can come up with the treater or the intervener, and feelings that are a little difficult to control at times. The treater or intervener, as mentioned, can be traumatized, can have nightmares, have difficulty sleeping, have difficulty balance, not being able to get away from the very difficult case they're dealing with, it going over and over again in their mind. A loss of a sense of boundaries, wanting to take over and make it better as opposed to seeing what your position and your role is in trying to help. Feeling overwhelmed and helpless. So on the one hand, if you feel overwhelmed, it can help with empathy. On the other hand, it can destabilize and make a person feel like they really can't help anymore. A big risk is unacknowledged, unrecognized, or unexamined feelings. So if there are responses to a traumatized child or adult and they're not acknowledged, recognized, or examined, that can be difficult. One of the things that those of us who work with traumatized children and family do to help others who are learning to do the work is something that we call reflective supervision, so that one has a sense of the feelings that come up as well as the specific work that's done, and recognizing that and be able to incorporate that in part of one's work. So risk factors: stressful life events that haven't been addressed and worked through. So somebody who's had a very stressful early life, been exposed to trauma themselves, have never worked it through, have just gone on, may be at higher risk for vicarious traumatization. Another risk factor is repeatedly being exposed to the cruelty of others. It can cause you to be hardened and cynical if you are hearing continually about cruelty of others. And then increased awareness of the frequency and profound harm of abuse and neglect can alter perceptions. You get to have a very negative view of the world, that there's so much harm going on, and as one's increasingly aware of it, there can be a sense of helplessness and hopelessness, and then the ability to get away from it and to be able to enjoy life may be altered in some ways. Other risk factors, we've seen this with first responders not being able or willing to discuss difficult aspects of work with spouses, family, or friends, painful or difficult. A lot of things that people do working with trauma, whether they be clinicians, first responders, or whatever, things that you don't talk about. Many of them are confidential, and that isn't something that you talk about, but then you have to hold it in, and you may need to find a trusted person to be able to share if it's catching up with you. Being isolated from a support system, working on your own and not having support and not having anybody to either talk to or be able to get away sometimes. So you can start to feel helpless, ineffective, and overwhelmed by continually hearing repeated traumatic material and over again. So there needs to be some balance, way to get support and way to get a break from it. The signs of vicarious traumatization: we've talked about feeling overwhelmed. We've talked about burnout, so avoiding work duties could happen as well. Negative emotions, interpersonal problems, having arguments with people a lot, not getting along with people. Can have health problems too, can affect your health. Some of the anxiety-related health problems people have are with stress, headaches, stomach aches, some dermatological problems, respiratory problems at times. So health problems can come up as well. Below par performance, not being able to do your work, not feeling it's hard, I just can't go into one more family and hear these stories again. And then some people find various ways to deal with it. Substance use is one of the ways. You can substance abuse, alcohol abuse as a way to deal with vicarious trauma. And then a really negative one, feeling that you're not that good, diminished self-worth, that I just can't do this anymore and I'm not doing a very good job. So the warning signals of vicarious trauma: increasing thoughts of clients' pain and trauma, that you increasingly are preoccupied with the things that you're hearing all the time. And you have less of a sense of safety and trust in the world, and can have intrusive imagery or nightmares. So we talked about that before, but these are warning signs to pay attention to. If they have trouble having fun, if you increasingly are preoccupied with the pain and trauma that you're hearing, and if the world doesn't feel like a very safe, trusting place. So what are the things that you can do to manage? First of all, recognize that the work you're doing may affect you. A lot of people say, oh, I can do it, it won't affect me at all. But that isn't the case. It's going to affect everybody as you hear about these cases. So what can we do to manage is try to create and maintain a healthy balance. Some work, being able to leave work at work to minimize the effects of vicarious traumatization. It's also important to recognize this can occur. If you're working with trauma, there's the potential for vicarious trauma in your life. And also know yourself well enough to recognize your warning signals for when you're feeling overwhelmed, might experience vicarious trauma, maybe feeling somewhat burned out. Recognize your own warning signals so you can do something about it. Let's talk a little bit about prevention, personal prevention first. Adequate self-care. One of the really important things in terms of adequate self-care is being able to say no, recognizing you're doing so many things that you can't take on another, even if it seems very important at the time. You have to know and honor your limitations and essentially exercise compassion for yourself. Let yourself say no, let yourself have some free time and get away from things. The other thing that's very challenging with traumatized individuals is there are a lot of needs, and at times it can be really difficult to maintain appropriate boundaries. So you may find yourself wanting to take over or make it all better. So it's very important to maintain appropriate boundaries. And then staying emotionally connected without being over-involved. That is, whose needs am I meeting at this point? Am I meeting my needs or am I meeting their needs? If you find yourself really over-involved and not being able to separate. And then when you leave work, being able to unwind on the way home, whether you walk or drive or listen to music or something else, being able to unwind on the way home. And then being able to leave work at work, not taking work home with you. This is a message that a lot of us need in the mental health profession, particularly when we work with trauma. And so when I read these, I try to pay attention to the personal recommendations. Intervention strategies, some things that work. Look at the stressors and address them one at a time. Say, I am stressed by some particular situation, and what can I do about that? What can I do to make that better? How can I strike a better balance, work-life balance, as opposed to not working all the time, particularly if I work with trauma? For many people, attending to spiritual needs makes a big difference. Spirituality is an important protective factor, and that's a really helpful way for many people to deal with these issues on a personal basis. Sometimes schedule a mental health day when you find you're getting overloaded. Just take a day off, take a day of leave, and do something that you really want to do that day, and stay away from work can be really, really helpful. And then if problems continue and you can't find a personal strategy that helps, seek help from somebody else, seek therapy. Find somebody that you can talk to. It can be for a limited period of time or a longer period of time, but it's important to recognize this is happening and there is help for it. And some of the self-care strategies that really make a difference. Eating well, a balanced diet. One of the things that happens a lot for people who are in very stressful situations working with trauma is they'll pick up whatever food they see, or pick up junk food with not a lot of nutritional value just because it tastes good. So a balanced diet can be really helpful, as well as healthy lifestyle choices, which include not too much caffeine, not too much alcohol, exercise, movement, yoga, walking. Just keeping yourself in pretty good physical condition is really important. And one of the things that we know in terms of exercise, whatever it is, that it tends to get those kinds of juices moving in the individual that helps them feel better. So self-care strategies, you can do a lot of them yourself, but you have to recognize in some ways that you're not doing them. Taking time to exercise, taking time to eat in somewhat more healthy ways is really important. So some of the main things that work in this area has shown that increases the risk and influence experienced vicarious trauma are current personal stresses in your life that are ongoing can increase your experience of vicarious trauma, feeling like you can't do it anymore. Family problems, relationship problems, mental health issues. One of the things, though, that I found in some of my work with people is actually, and even people who work a lot with abuse and neglect in very difficult cases, one of the things that I found was that they didn't complain as much or feel as much stress by the cases they heard, young child cases, as they did by the administrative challenges, the organizational influences, the legislative changes, and all of the kinds of things with the administration and the frustrations, that was even a greater factor influencing vicarious traumatization. And then physical and medical challenges can also play a role. If you can't do things that you did before, or it's harder to do them, that can also lead to vicarious traumatization, as well as maturational factors. Okay, intervention strategies, professional strategies, seek professional help. Get some help. Being able to talk about it can be really, really important. I'm obviously a mental health professional, so I believe in that and know that it helps, but that's something people could think about. Making a plan to regularly engage in self-care activities. If it's helpful, develop and maintain professional networks, so that you can hear what other people are doing and even get some support in a professional way, hearing about different things. And then have realistic expectations of what you can do and what your team can do, not unrealistic expectations. Because if your expectations are unrealistic, then that makes you more likely to become overwhelmed and with the work you're doing. So setting realistic expectations, particularly when you work with trauma. Coordinate work and personal goals, and we mentioned that many times, and then periodically evaluate your priorities and goals. Not necessarily once a year, but maybe once a month. How am I doing? Do I like what I'm doing? Am I doing it as well as I can? Just thinking about it from time to time is really important in terms of helping to work with traumatized individuals. Make sure that you're clear on your priorities and goals of what you're trying to achieve. Other strategies that help: regular meetings. One of the things that occurs not infrequently in agencies is that there's administrative supervision. There's supervision in agencies to make sure everything's going the way it's going, but not individual supervision, and not supervision that takes where one moves away from the administrative issues and just deals with some of the clinical, relationship, other kinds of issues that need to be dealt with in working with, in doing this very difficult work. So regular meetings to discuss situations, and also you heard me talk before about reflective supervision, and here reflective practice, where feelings can be shared in a way that people can listen to them. Problem solve together at regular meetings, and also providing ongoing education, learning about some of the things that we've talked about here about why it occurs, the risk factors, and what you can do about it, and then other innovative strategies that may help at these meetings. So learning to understand and process the effects of trauma and personal responses to the work, and being able to talk about it, will then make the whole team and group be able to work more effectively. So we come up with 4 maxims for caregivers, and you can see them. Giving to others gives us a sense of satisfaction, but we must be sure to give to ourselves as well. So particularly when you work with trauma and traumatized situations, it's important to help other people, but we also have to take care of ourselves. Because if we take care of ourselves, we're better caretakers to others. And we need time to rejuvenate ourselves, and we have to take responsibility to do that. That's very important. So set realistic limits for ourselves, healthy realistic limits. for a more relaxed and mutually supportive environment, particularly if one's working with very difficult trauma situations. You need to have a supportive environment, need to figure out ways to make it not pressured all the time. And not that it's not going to be pressured some of the time, but at least there's some time for more relaxed and supportive activities. So identify activities that rejuvenate and heal. And these activities are going to be different for different people. So if it's taking a walk, if it's going out with friends, if it's going to a movie, if it's going to an area that's very beautiful, different people rejuvenate in different ways. This is one of the images that I find very beautiful. It's Machu Picchu in Peru. It's very lovely, and it doesn't have to be somewhere that's far away. There are beautiful places much nearer to home. Just taking a walk somewhere where it's peaceful and just getting away can be really, really important, even if it's for a few hours. So I hope this was helpful to think about some of the different ways to help with issues of vicarious traumatization or secondary traumatic stress that occurs not infrequently for those of us who work with trauma. Thank you very much.